I have a patient, a young beauty, simply a star, who suffers from constant pain syndromes in the lumbar region, in the left, in the right shoulder joint, in the left shoulder area. This pain occurs here, this pain occurs here, and this pain occurs here. But the pain only occurs when she stands on her right leg. When she stands on her left leg, everything becomes symmetrical and the pain disappears. So there is some instability in the right leg. But what is it related to? The hip joint, the knee joint, or the foot? I place my patient on a chair. Somehow, for an athlete, she doesn't stand very confidently. So, it's unstable. There it is. And I look. Somehow, the arch of the foot concerns me. On one side, the arch of the foot is large. Please take a closer shot of the feet. And on the other side, the arch of the foot is small, and there's some pain that interests me here. And here. Can you stand on one leg? I take the patient's foot and look at the level of the arch to see if there is any tenderness. Normally, palpating the foot shouldn't change anything. I palpate the other foot. Can you see that I took the other foot? I check how much sensation there is. Did you say something? So it doesn't hurt at all since there's no loud screaming. I check if the same reaction is on the other leg. No, everything is soft, there are no problems. But as soon as I take the other foot, I see that against the background of muscle atrophy, the bone structures protrude and sharp pain arises. What do you think a foot that bears such a load from the bone structures wants to do? Reduce the load. I want to ensure whether the foot is indeed primary for her. I just take a small support and place it under the foot. Like this. You can simply choose a more convenient option. I just place the support so that the height of the foot is a little higher, like this. Now she is standing on a steeper arch of the foot. I want to know if anything changes. I ask the patient to check the pelvic wing, to check the pain here. But I don't see any pain. I want to check if I made a mistake. I remove the support from the arch of the foot, put more weight on the foot, and see, does anything change here? I don't hear anything. So the pain appears. So the foot is to blame. But is the foot itself to blame? Maybe the nerves are compressed here, or maybe the nerves are compressed higher up. I look to see if the common peroneal nerve is compressed at the level of the knee joint, because somehow, if you look at these slender, graceful, most beautiful legs, they are just a dream for any man and woman. Somehow, the knee joint here is more even, but there is a bit of internal rotation of the knee joint. Is this visible well? Here the joint is standing absolutely straight, and here the joint is crooked. Can you see how the joint stands straight? And here the joint shifts like this. I am looking at the popliteal fossae. I am looking at the popliteal fossae here. Please turn around. Each of you can palpate the popliteal fossae. You find one popliteal fossa and look at the other. Oh. Look here. Do you see how straight the foot is here and here? Stand straight. No, don't move. Look. It feels like the leg is hyperextended here. Okay? Here the foot is, the knee is straight, but here it's hyperextended. And if you stand sideways like this, can you clearly see that the foot is hyperextended here? Can you see it? Here the knee is straight, but here it seems to be shifted backward. And here a pronounced pain syndrome arises. I want to find out if the problem is really in the foot. In the knee joint area. I am capturing the knee joint. You can take a much smaller fastener. I can't do it one more time. So the tip, I need to wrap it under the knee, like this. Like this. Exactly like this. I have now brought the head of the tibia closer to the fibula, compressed the bones to free the nerve. I look, how is the pain? And how is the pain? Leg over here to me. And how is the pain? And there is no pain. So she has a problem with the pressure on the nerve that passes between the two bones. Because of this, the foot is unstable. The lumbar spine is overloaded. The shoulder joint is stressed, and the head of the fibula is loaded. This is how the search for the cause of a local problem arises. If I hadn't received the reaction from squeezing the two bones at the ankle level, I would have looked to see if the problem might be related to the pelvic region. And then I would have put a belt on the pelvis and here. If you stabilize the pelvis and your pains go away, wherever they may be, it's a problem with the pelvic region. I look at how our patient's pelvis is. Nothing helps. It was like a wing, and it stayed that way. How is the pain here? How is the knee here? Her pelvic region is normal. I want to be heard by women who have ever gone through the childbirth process. If you have ever given birth, remember that postpartum rehabilitation is the most important thing you must go through. Wherever you have a pain syndrome, try using a strap to fix the pelvis. And if the pain subsides in any region, it is a sign of pelvic instability as a postpartum consequence of bone and sacrum deformation and semipelvisis. Therefore, if your pain subsides when the pelvis is fixed, no matter where it is, mom, the problem is in the pelvis. If your pain subsides when you fix the knee joint, no matter where it is, the problem is in the knee joint. If your pain subsides when you lift the arch of the foot, no matter where it is, the problem is related to the arch of the foot, and therefore no exercise will help you. If you open the internet, I counted, didn't hesitate. There are more than 300 types of exercises available. What kind of exercise will help my patient if she has instability of the fibular head? She has a nerve compressed here. How can you achieve effectiveness by working and loading different parts? No way. And that's why exercises exist, but they are ineffective not because the exercise is bad, but because it is done without considering the individual characteristics of the patient. For this patient, before doing exercises, it's necessary to restore the fibular head, relieve the nerve pressure, stabilize the foot so that it stands optimally, and only then proceed with exercises. Dear friends, if you can hear me, it means your moment of glory has arrived. It means joy has come into your life. You have found the opportunity to listen to your body. This is not a complicated method. It is simple and accessible to everyone. Each of you can find your own pain. Check if something changes with the pain when you change your position. And then you can find the cause of your condition. If it's the entire limb, stabilize the pelvis, stabilize the knee, lift the arch of the foot, and you will find the cause that leads to this disorder. My patient has issues related to the small pectoral muscle syndrome, numbness and pain. Numbness and pain of the small pectoral muscle. She has cervicobrachialgia issues. She has problems related to the lumbar region. If she had gone to a classical neurologist, there would be 3 diagnoses: lumbalgia, cervicobrachialgia, and small pectoral muscle syndrome. Each is treated. You won't believe it. Each is treated separately. Anti-inflammatory drugs, painkillers, muscle relaxants, and special exercises for the shoulder joint, the small pectoral muscle, and the lumbar region are prescribed. And each area is vigorously massaged. With anything, just to give the appearance of treatment. But my patient has a problem in the knee joint, which does not manifest itself in any way. Therefore, to help our patient, we will now quickly perform the restoration and correction of this nerve with you. And then we will continue with restoring the health of our models.